officially leaving this race. So. Hey. Hi everyone, welcome back to my channel and welcome to my vlog of me moving to Butterworth for my trauma and emergency rotation at Butterworth District Hospital. So stay tuned. It was fun. It was so informative, so educational. I hope you guys enjoy. Love you. So this was my first day in the treatment room or trauma room. It was very intimidating. The cases were casing, but I was welcomed with open arms. So we're going to talk about X-ray interpretations quickly. This is one of the fractures I showed you prior in another video. It was a femur fracture. And the next fracture is a pleural effusion. So if you see the accumulation of white on the left, yeah. Luckily, I had the luxury in my first week to start doing cesarean sections. You guys know that I do cesarean sections all the time, so it was just a nice experience to do something that I'm quite well versed in. It was good to assist, and the theatre is quite small from the theatre that I'm used to, but I mean, you can't really complain. It was an enjoyable experience nonetheless, and the patients were so adorable. So in this case, I was scrubbing in for a maternity case. We're doing an emergency cesarean section. And yeah, we have to don our aprons, shoe scrubs. We have to scrub up and wash. And then these are our theatre rooms that we've got. We also deal with gen surgery cases, like amputations and stuff, and circumcisions and castrations as well. In this case was a maternity case. As you can see, we were just ushering the patient out. And this was her bouncing baby boy, who was very healthy. The next exam was me doing a abdominal ultrasound on a woman with a 36-week gestational age. So we're just doing a routine exam on her. One morning, I came across a patient who had a hugely distended abdomen, and the reason for that was ascites. So ascites is usually accumulation of fluid within the abdominal cavity. The main cause of this patient's ascites was chronic liver disease. In another morning, I saw a male with a huge hydrocele. So a hydrocele is fluid accumulation within the scrotal sac. To give the patient immediate relief, we did a therapeutic tap and we drained a lot just to help him relieve his pain. My next patient was suffering from a chronic case of cellulitis, and she was a known DM patient, so she was also susceptible to a diabetic foot, and she suffered gas gangrene as a complication of that. So we had to admit her into the ward. My next patient suffered a proximal radius fracture, and we had to do a above elbow back slab on him just to immobilize temporarily for 2 weeks, and then he was going to come back for a review to see if it had healed. If it hadn't healed, we're going to do a full POP for the next 4 weeks and monitor his recovery. Otherwise, it was quite easy to do the back slab. It's not as complicated. In this case, we just use bandages instead of wrapping it with the full POP, like you've seen in another video. Yeah. We call our transport. Our transport is so pretty, I don't want to lie. Yeah, I say good. The first weekend in, we decided to do a girl dinner, so we all allocated ourselves to different portions of the meal. So I did the chicken stew, another friend did a chakalaka, another did a potato salad, and another did some rice. And then we also had a veggie portion for our dear friend because she is a vegetarian. Yeah, I say good. kwabaphansi sihambile kwabamnandi noma kubuhlungu bowazi but nothing lasts forever so I say good bye 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 yeah I say good bye 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 Day I managed to do or see 4 cases. So we had 2 finger amputations and we had 2 male castrations, right? So the male castrations were because the testicles were experiencing aggressive cancer and they were about to metastasize, right? And then the finger amputation were needed because the patient suffered from human bites. So yeah, it was all in all a good theatre run. It was so productive, so informative. It was just nice, and I love the fact that I was able to end off on a high note in theatre. I hope you guys enjoyed the vlog, and I hope you guys saw that it was a great experience to be in Bato with.